Hey everybody, Suzanne here with Caregiver Haven. Seniors and those who care for seniors find themselves frustrated by the healthcare system. And so today we're going to talk about the very things that are most commonly found that go awry in the healthcare system today and what solutions are out there. As a physician assistant, I have seen how we can fix these problems, but also as a caregiver to my mom, I saw what patients went through looking from the outside in. So today we're going to fix these 8 problems. They do have solutions. So let's get started. What we're going to learn today are these most common frustrations that all seniors deal with, and you'll be surprised how easy they are to solve. Let's take a look. Access to care. This is number 1. We're not talking about us who have primary care physicians and specialists in our area. We're not talking about those people that don't have physicians. We are talking about you or your loved one that has a primary care physician. In fact, you may have several physicians that you see on a regular basis. So the problem is not about having a doctor. The problem is about not having access to your physicians when you need them. You might wait on the phone forever to finally get somebody to help you. Remember, you are not calling the doctor's office. What you're doing is calling into a call center. And the call center does not have access to your medical records or know what you're talking about. Even though they say they might be a nurse on the other end, they are still an operator in a call center. And you could be in another country or even another state for that matter. When you do finally get this person on your phone and they tell you that it's going to be 3 to 6 months or even 8 months out there before you get to see the doctor, then you have a problem. And not only are you going to have a long wait to finally get in, but what about the wait in the waiting room? And then you see the doctor for only 5 to 10 minutes? What's that all about? And then there's the lack of geriatric specialists in your area. Why do I bring up geriatric specialists? Because these are the folks who bring in the whole family to open communication and they discuss medical care, such as directives, health power of attorneys, chronic diseases that you, the senior, is dealing with, preventive medicine, etc. So since you know what your doctor needs and what you need, what is going to be the solution? Okay, one of the first things that we have to do is, and this is part of your membership, is to solve the problem of having access to your physician, even though they may not be your own primary care. What my patients did was they set up appointments with me, their primary care physician assistant I was, every 3 months. And they could cancel them if they didn't have any need to see me. That was fine. But they always had a standing appointment every 3 months, 4 times a year. But let me explain to you what we did in these appointments. We spent time talking about their next visit and what that visit would be about. And of course, we could always change whatever they needed to talk about when they came in. Also, I've given you a handy guide, and this is part of your membership. As I said, it's a guidebook on how to leave messages. I've recently upgraded it and I've also updated it. So it talks about not only leaving the messages, but extremely important about what you want to do with this call center that you have to call in order to get an appointment. And it also shows you how to have a doctor available when you need them and what your options are. So you always, always, always can get a hold of somebody to help you. It's called No Hassle Healthcare for Super Ages. So look for it below. If you're not a member, you're more than welcome to join. Please see caregiverhaven.com and you'll have access to this guidebook as well as many others. Okay, number two, let's talk about communication issues. The other problem is we have limited time with our physician once we're in the office, and we have to be very specific about exactly what we want to talk about and the choices we have for our treatments. This means very, very precise, specific conversations. Did you know that patients are telling me that the nurse tells them that now they're no longer allowed to talk to the doctor about any other problem except the one they came in for? That's crazy because healthcare is not dealing with just one disease. Every disease is attached to another somehow, some way. So, what we do to get around this is we just ignore those instructions. We give the doctor all the information he or she needs in order to treat us properly. The other thing about communication issues that you have to understand is medicine has a language itself, and many people, the general public, do not understand the terminologies. So when something is said and you do not understand the word, it is perfectly acceptable for you to say, stop. I do not understand that abbreviation. I do not know that word. I do this myself very many times when somebody is talking to me about technology. I do not understand their abbreviations. So, perfectly okay to stop the physician and ask. All right, we want to make sure our communication is clear, but we also want to make sure we're not getting the wrong test or wrong preparation. Like, for instance, let's say you're going for an ultrasound of the bladder and they need a full bladder and you just emptied yours. Not good. Also, the wrong medications. In fact, medications that are going to interact with your over the counter medications or any other medications you're on. And if we do not, if we do need to follow up with the doctor, that we have a plan in place in order to get in touch with him or her about the follow up. Significantly, over 30% of tests, whatever procedures they are, tests, labs, specialists, are never followed up with your primary care physician. And so those results can easily fall through the cracks. You may see them, but that doesn't mean that your physician sees them and puts out the alarms. Most of the time, it's their nurses that are looking at the results and giving the bad ones, the negative results, to the doctor to get in touch with you or to have you come back in the office. But still, that does not mean your result won't fall through the cracks. So make sure that you always have a follow up appointment, either a telemedicine appointment or a actually walk in and see the physician appointment. One thing, before you get on that telephone or walk in, make sure you have your own copy of the results. You can download them, print them out through the portal, get those and put them in front of you and put your questions on that paper. Okay, what are some other solutions that work? So before you go in, like I said, write down exactly what is going on with you and exactly what you want to talk to the doctor about. Keep this piece of paper in front of you. So let's say you're going in because your back hurts. Stick to your back. If you have any other problems that are affiliated with your back, let them know. If you're concerned about your blood pressure, let them know. Write that down on the piece of paper. Do not ever hand this piece of paper to the doctor or the nurse. They tend to ignore it. I've seen this happen over and over again. You can make a copy of it and give it to the doctor. But always keep your copy so you can make sure everything on your list has been checked off. Make sure that you confirm what tests are being ordered and why they are being ordered. Over and over again, I have seen patients come in with labs that some other doctor ordered, and they've cost them $800 to $1,000 for labs. And I say, why did you have this done? And there is no reason why they had them done. Also, you have to confirm that your insurance is going to pay for these labs, and make sure the diagnosis that they're attaching to the order is correct. This guarantees your insurance will pay for it. My own doctor made up diagnoses to put in my chart. And when I told her they were not true, she said, well, we just need to satisfy the insurance company. That is called fraud, and you do not want to be a part of it. If you knowingly agree to fraud, you are liable for it. Medicare can drop you. So, also, to get the name of the facility and then call over there to find out exactly what the preparation is going to be. Do you need to go off certain medicines before any tests are done? Do you need to state that there are certain things going on, that you're not feeling well, or perhaps you've been exposed to COVID and you shouldn't be going in at that time? Please make sure you call the facility and let them know any changes. And when you're getting a medication, always ask the pharmacist, not the doctor. Ask the pharmacist if there are any interactions with any other medications you're on, and make sure you go over the list of medications with your pharmacist, especially if it's a new drugstore. Then also, if you have any chronic diseases like liver or kidney failure, ask if this medication will do more harm than good. This is extremely important, and you have to ask the pharmacist about this. Next, the doctor will tell you to follow up if you have any problems. That's a general statement all doctors use. However, you're not going to be able to get back into the doctor's office unless you set up an appointment or you make sure you can get a message to them, either by cell phone or text message. And I'm not sure that you want to wait so long as to ask your doctor when you should follow up, since these messages don't seem to get through. Okay, next let's talk about coordination of care. I know the last slide was a lot to cover about communication, but it's something that we always talk about, especially I did with my patients, is I need everybody to coordinate care. So we could be very clear about what we're doing, why we're doing it. And my patients could also stop me if they didn't understand something, or if they were afraid it was going to cost them too much, like a medication, or they get out of the office and they're not able to connect with me again. So let's talk about the coordination of care. I'm beginning to see at an alarming rate that doctors are no longer reading your medical chart anymore. In fact, when you leave a message for the doctor, 9 times out of 10, it's the nurse who's responding to your message and knows nothing about your condition or what you even discussed with the doctor. So, here are some problems and solutions we look at. So, we get the best coordination of care we could possibly ask for. All right. What do I mean by unnecessary tests and no follow-up with the doctor and what they ordered for you? What I mean is, what is it, like 40% of tests are unnecessary and you don't need them. I see this over and over again with seniors and our members in the club. They get a test and they think they have to go in for it. And I'm like, why are you having this test? Well, the other doctor ordered it and I got it done, and now my specialist wants to order it. And it's been 2 weeks or 3 months out and they're ordering the same test again. Not okay. And Medicare will not pay for it again. So therefore, you have to ask, why are you getting the test again? Or if it's an unnecessary test, I won't go into detail here, but there are some labs that if you take a lot of vitamins, your labs are going to show real high. So why are you getting the test if we know all you have to do is take a bunch of vitamins and the test is going to come out normal? That's very much the case with your vitamin B, your vitamin A. No, I'm sorry, your vitamin B and your vitamin C's. If you take a lot of those, they're water soluble. Your lab will show that you have a lot of them and you just pee them out when you are done with them, basically. So you have to be careful about asking why you're getting these tests. What are they going to do about them if they're normal? What are they going to do about them if they're not normal? So make sure you have that follow-up included. All right. As I already mentioned, when was the test last done? And is it done by another doctor? If so, you should have a result and you should take that to the doctor that wants to order the exact same test. When do you need the test repeated? This is important. Super agers and those who care for them make sure that every specialist, every physician knows what tests were done and when they were done, because the medical records are so wrong. The second thing you want to know is that super agers always check back and get those results even before discussing them with the physician. And then last but not least is, when does the test need to be repeated? Let's say you have a lump in your breast and you're concerned about it, and the doctor orders you to get all the necessary tests for it, and you get the treatments, you get the work done. When do they want you to follow up? Especially if they say, it doesn't look suspicious, we're not worried about it. You have to follow up to make sure that it's not getting larger, and you have to follow up to make sure you're not going to be worried about it. So you don't want to come back in 6 months and be told, yeah, we should have done something earlier about this. Okay. So you got to make sure that you're not going to worry about this. That's part of trusting your doctor, but your doctor has to have all the information to make the correct decision. Affordability and insurance. As we know, Medicare does not pay for everything, and the doctor's offices are now stating that they see that, well, let me start over. Affordability and insurance. We know Medicare doesn't pay for everything. I'm going to show you a form on the following page that was handed to one of our members, and it's about being responsible for what Medicare will not pay. That's fine and great, but when we tend to look at specialists, Medicare isn't paying for what they should be. And most facilities cannot sustain a profit if they're not going to get paid, right? So they have to charge more. And this is called excess fees. And you're going to start being charged for them. If Medicare will not pay, you will pay. Let me show you what I mean. First, let's talk about the procedures. This is common, as I said, in specialist offices. They're going to do extra procedures on you that you don't need done. For example, one physical therapist company charges per exercise that they show you. So they charged one of our members $300 to show them 3 exercises. And when she demonstrated and told me what these exercises were, I told her they were just simply 3 yoga exercises. Insurance would not pay for them, so she had to pay $300. What's worse is she had gone 4 times and she had learned 12 exercises. She had a $1,200 bill. So be wary of specialists who tell you that you're going to need even a ton of work, like lots of cavities or deep cleaning, or we're seeing this, or we think you need a crown. You've got to get a second opinion before anybody starts any of these procedures. You've got to know. I have seen over and over again people go in and get second opinions, and you know what? They don't have cavities, they don't need crowns, they don't need root canals, they don't need to see those exercises I'm talking about. They can get all this information themselves online, and they should have said up front, this is not going to work for me. Okay, so here are some of the solutions that super agers know about. First of all, you tell the receptionist that you want no extra procedures done in the office that are not covered by insurance, such as they want to dilate your eyes for an eye exam. That's pretty normal, and that's normally covered by your insurance. You'd have to check with them or the office. But also, they want to start an IV on you to help with the contrast to see your eyes better. That is not covered by insurance in most cases, and so you should not have that. Secondly, If you're getting a referral to another doctor, super seniors always have to check to make sure that doctor is in network. Many healthcare facilities today require their healthcare providers to only refer within their own facility. They cannot go outside their facility. And what I found was that I did not want to refer my patients to certain specialists. They just weren't any good, and I knew they weren't. So I referred them to someone else within their network, but it was out of my healthcare facility. And I actually had to document this on the chart so I wouldn't be called on the carpet for it. So I always put patient requested Dr. So-and-so from such and such a clinic instead of referring them to the doctors within our own clinics. This was my choice. I did this because I wanted my patients to get the best care. Also, third, labs are covered. Some labs are covered by your insurance, but other labs are not. And as I mentioned before, some of them are going to be $800 to $1,500. So you've got to know what labs you're getting. The most common ones you're going to see is something called a CBC that checks your blood, a CMP that checks other things in your blood, and a lipid panel is going to check your cholesterol and your triglycerides. That is something your doctor can always order for you. That's usually covered, most likely covered by your insurance company. And if you're a pound overweight, they can put down obesity. That's not a problem. That will cover it. All right, let's take a look at this. I just want to bring up this paper for you. I mentioned it earlier. This is a paper that you're handed and told to sign, this financial policy. I want you to look at the top arrow, insurance claims. As a courtesy, they're going to accept your insurance and will file the claim for you. Your insurance company makes the final determination regarding your eligibility and benefits, and you agree to pay any portion of the charges that are not covered by your insurance company. Well, wait a minute. I have several problems with this. Number one, I have to sign this form before I even go in and see the specialist. I agree to pay for anything not covered by my insurance. What if they decide to, give me that IV to see contrast better? I need to know what the costs are. The other thing is they say, if we are not participating in your insurance plan, we may file the initial claim, but if payment is not received within 45 days, well, insurance companies always take 120 to 6 months, 180 days to pay for anything. So what are we doing here? You're going to have to pay in 45 days. It once took me 13 months to get a refund from a company. After my insurance paid it, they wouldn't pay it for 13 months. So just say, you know what? I need to know every procedure you're doing with me today in this office, and I need to know that it's going to be covered by my insurance, so I am not stuck with the bill. And if you think it's not going to be covered by my insurance, then I need to know how much every single procedure is going to be before I agree. The good thing is found in the second arrow. Here, you can get a good faith estimate. So be sure to write this down in your notebook, the procedure and how much it's going to cost, how they're going to write the diagnosis so it will be paid for by the insurance company. Unfortunately, our legal system has invaded our healthcare system, and you can see by this form the legal jargon used to get payment. So thank goodness we can still get care, but Medicare is not cheap, and Medicare does not pay for all these extra things your doctor wants to add on. Chronic disease management. Superagers also know that chronic disease can be maintained with proper management. Chronic diseases are those things like high blood pressure, diabetes, obesity, congestive heart failure. These things can be managed, but they can't be cured. It's not like a virus or a cold. It's going to run its course and then we're going to get better again. So it is important with chronic diseases that our doctor stays on top of it and knows exactly how your disease is progressing at all times. Let's take a look and see how we can make sure this happens. It is up to the super aging seniors and their families to make sure the disease stays stable, not getting worse or not causing other chronic diseases to rear their ugly head. For example, if you have congestive heart failure but didn't have, legs swelling 3 months ago, I want to see if my patient's legs are swelling now. So my super aging seniors and their families knew to get these regular checkups. And we also discussed how to prevent the progression of chronic diseases. We can manage them. We just can't cure them. So, as I mentioned before, I like to have my patients come in every 3 months to just have a checkup and see if anything has changed with them. This is a threefold purpose. First, I want to make sure their chronic diseases are stable, and so do you. So, any changes, get back into your primary care office. Number two, I want to make sure that if they had any arising issues or side effects from their chronic disease, they would share those with me. There is no judgment here. Share them with me. Let me know. Don't worry about it. I'm not going to give you another pill because of it. And I'm certainly not going to give you another pill for the side effect of another pill that has a side effect. That just doesn't work. And number three, I want to look at my patients. I always wanted to see how my patients were aging. And after 3 months, I can see if there are major changes, whereas usually the family is seeing the senior often and doesn't see the changes. But I'll tell you, pictures are speak 1,000 words. So my super agers have always shared with me what they were giving up and what they were substituting in its place. This was one of my rules. Aging is a linear progression. It's not a cycle of life. It's linear. We keep growing. We grow and grow and grow. That's what life is all about, even for our seniors. So I wanted to make sure that, like, if you were giving up golf, why were you giving up golf? Could you do half swings in your golf? Because there are pro golfers out there that can teach you to do half swings. Are you not walking as well as you used to? What are you going to do in its place? Because you have to keep going. So what else can you do? Once we slow down, not good for super agers. All right. Let's talk about mental health changes too. It's important that seniors and their families evaluate how their memory is, if there's just common memory loss, or if there are any diagnoses like dementia that has to be addressed quickly. Okay, when we get under stress, we're going to start forgetting things. That's very common. That is not something, we'll forget where we put our keys, or we'll forget just misplace something, basically. So that's common. But speaking of something, all super seniors do is have a neck up checkup. This is what I did with my patients all the time. The neck up checkup means that we're going to be looking at the eyes. Can we see? We're going to check the hearing. We're going to check the mind. Is it being stimulated on a regular basis? Also, too, we have to know if there is any pain going on, because pain, I call it panger, because it makes us so angry. It makes us so irritable when we have to live in pain 24/7. And it can lead to depression and anxiety and stress. So we have to address these issues, any of these issues, quickly and deal with what the underlying cause is. We can also, from pain, we have sleepless nights, we have worry, we have to think about medications, we have to think about family issues, poor eating habits, lack of mobility. All these things cause mental stress, and we want to eliminate them. So, when we address these issues, we're going to check off the right boxes. Are we eating well? Are we exercising, moving? Are we stretching our joints? Do we do those yoga exercises? Not hard, they're just basically stretching. And how much pain are you in? We have to look at that. That's why I like the 3-month visit. So trust the doctor to keep you healthy and happy and on that super aging road. Let's look at preventive care. So, preventive care and health promotion. What's this mean? So, in preventive care, we're getting all our screening tests done. And I have given you this guide for both men and women over 65, and it's current. So, you can see it in your membership account. Why is this important? Ultimately, it's up to you to decide what vaccines and what screenings you want. Most physicians will respect your decisions. However, you need to know what's out there so you can make the intelligent decisions about what you want and what you don't want. Also, this is always a good time for you to go over your list of ADLs and IADLs, activities of daily living and independent activities of daily living. Are any of these getting more difficult for you? We have to address them because, again, we're giving something up. We've got to pick something up in its place. We keep moving forward. All right. ADLs, of course, are your activities of daily living, like your cooking, your bathing, your personal hygiene, and things like this. And your ability to maintain your finances or do your grocery shopping are more of your IADLs. They just keep us going. This also includes socializing. And this is where superagers start recognizing that they may be losing things that they've always done. And they have their families to back them up. So, there are days we don't feel like getting out. There are days we're tired. We have to pace ourselves. It's one of the things we deal with in the membership called life balance. But one of the best ways that superagers continue on their linear path to growth is to attend weddings and even funerals. And in here, we see family members we haven't seen in a while, and they tell us we look great. They tell us we're fantastic. They're so glad to see us again. So we know that our diet, our exercise, our mind, our socialization is working for us. So stay engaged with as many activities as possible so people can tell you how great you look. And let's talk about technology. It's a huge problem for anybody who doesn't know the program or how the software works. These companies, these healthcare facilities, they give us a patient portal, and every patient portal is different. And we have to dig through it to figure out buttons to push, what buttons to push, how we got here, what we need to do. It's almost impossible. So, one of the things you have to do is relearn every patient portal if you're going to different facilities. Some seniors are very savvy at this. They do it like they're 20 years old. And others of us, we just need a piece of paper. I have to read a piece of paper. That's called tactile. I have to be able to hold a paper. I have to be able to read it at my pace. I have to put pencil on it or pen on it. I have to underline. I have to make notes on the side. And I will never go in to see my doctor unless I've got that piece of paper in front of me and we are going over my notes. So, the problem you have in healthcare as well is using templates. We were held to use templates, and templates are good, except that one template doesn't fit all. There's a lot of bells and whistles on this template. And what I mean by that is, for instance, if you buy a subscription to, let's say, Netflix or Hulu or something like that, well, there's thousands of movies and shows on them, but you don't use all of those. Same thing with cable. Cable offers you 500 channels, but you have your main 3, 4, 5, 6 channels you use, not everything. That's called a template. The same thing with your car. Your car comes from a template. It's got all the bells and whistles on it. In the first 3 weeks of owning a car, you're taking all the fuses out of every bell and whistle that's beeping backwards, blasting I don't know, buzzing, everything. So we make things and customize them to ourselves. These medical templates just have too much information on them and they're irrelevant. And that's where we get into trouble because nobody is checking these templates to make sure our medical information is correct. And the insurance company is reading this and they're denying us or they're raising our premiums based on these templates that are not correct. All right. So, what I want you to do is to get your chart, look at it, understand the technology, or print it out and take these reports actually to your doctor. The doctor does not see your patient portal, nor do you see the doctor's personal charts on you. They tell you you do, but I promise you, from being on the inside looking out on the other side of the exam table, I will tell you what I wrote in charts and what you actually got are two different things. And you will see the shock on the doctor's face when you show them your chart and say, "What's this?" They're like, "What? I didn't write that," because everything goes into a template. So even if you try to correct the information by sending a message through the system, it's not necessarily going to get there. Nobody's going to change anything. You keep checking back, checking back, checking back. Eventually, you're going to have to go in, set up an appointment, sit down with the doctor and say, "Please change these things." Nurses cannot change a lot of this information. Med techs can't do it either. You have to have the doctor do it. So, one of the first things superagers understand is that they don't have to use the technology. You can get a hold of your doctors, medical providers, and sit down with them with the chart in front of you and make sure it looks right. Just like this doctor, he printed out his own notes, showing them to the patient, saying, "Are these correct or not?" That's what you're looking for. It's an amazing way for you and your doctor to partner, and you're not out there winging it. Take that printed copy with you. Don't give it to the nurse. Have the doctor go over the chart with you, including the medications. I can't tell you the number of times I've gone in and said to the patient, "Okay, I see the medications you're on is this, 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 this." And they're so exasperated and they go, "I just told the nurse I'm not on those medications." And I have to explain the nurse cannot change the medications in your chart, only I can. So telling your nurse about this didn't do any good. I'm sorry she asked you about your medications. I'm the one that has to take the medications and the diagnoses that are wrong out of your chart. That's what medical providers do. So ask them to print out for you a copy of what they have. And a big trick here is I know that if I sent my patients up to the front desk to get a copy of today's visit, they would be charged for it like $25. But I would print it out myself and I just go to the printer and get the copy and give it to them. And that's what all my doctors do for me is they know. And I say, "I don't want to be charged $25. Can you just print this out for me and I can keep it?" Because if I have to go to a specialist, at least I got a copy of my primary care doctor's visit. I got a copy of the specialist's visit. I got a copy of everybody's visit. So I just have the doctors print it out and they're fine with that. The doctors are really there to help you. They know what good medical care is and they know why you're doing this. So this is why out of all of this, you want to get to know your doctor. Okay, so let's look at some of the things that are most important. As I've mentioned several times, I want you to be able to see your doctor every 3 months and to get your doctor. Super agers do this. I mean, they text their doctors. They call them on the cell phone. They're not waiting in offices. Agers are also in charge of their own medical records and their own medical health care. They know this. And I will tell you that super agers knew to call me. They knew to call their friends who were physicians and nurses they trusted and family members who were in the medical profession. They knew this. They also know how to exercise regularly and to keep moving, and they have the mobility. And they do their preventive screening tests. They know what vaccinations they need and they want, and others that might be coming their way. They keep their mind stimulated and they make sure that they can see and they can hear like they did in their youth, even if that means wearing glasses or hearing aids. They also realize that they have a partnership with their physician. but they are ultimately responsible for their own health. They know eating fast foods, they know eating processed foods is not going to do it. They know that they have to eat solid foods with 1 or 2 ingredients in them at the most, and they have to stay away from all this processing. They also are not afraid to ask questions, especially about what's being ordered, why it's being ordered, what's in my chart, things like that. And they're not afraid to advocate for themselves when those medical bills start piling up. They know they're not going to stress over this. They know they're going to call the office and talk to the billing manager and say, not acceptable. I did not sign that paper. I did not agree to any of these tests. I said that up front to the receptionist, and you don't have the paper signed. And if you have to sign the paper, then you put a note under it saying, I do not agree to any tests that will be unnecessary in order for my Medicare to cover this one visit for me today. And you make sure they got to put that in your chart, and you ask for a copy of it at the front desk as well. So these are all the things that super agers really do, and they enjoy their life and they live with the gratitude for all the things that they have. And I hope that this knowledge of just the little things you do can go a long way in your healthcare system. So you don't have to worry about getting the medical care you deserve as the senior you want to be. Thanks so much, and we'll talk later. Take care.